So in today's video, we are discussing about age-related macular degeneration which occurs in eye. First, let's know about the macula. The macula is part of the retina at the back of the eye. It is only about 5 mm across but is responsible for our central vision, most of our color vision, and the fine detail of what we see. The macula has a very high concentration of photoreceptor cells, the cells that detect light. Age-related macular degeneration is the degeneration of photoreceptor cells that are present in the macula or retina. The macula has a very high concentration of photoreceptor cells, the cells that detect light. They send signals to the brain, which interprets them as images. ARMD occurs commonly in people over the age of 50. Age-related macular degeneration is classified into two broad categories, that is, wet or neovascular macular degeneration and dry or geographic or atrophic macular degeneration. Among the dry macular degeneration and wet macular degeneration, the dry macular degeneration is most common and is found in 80 to 90% of patients. Let's go through some basic anatomy of the eye which is necessary to make you understand the topic of age-related macular degeneration. The eye globe is also known as bulbous oculi, which lies in a pyramidal-shaped bony orbit. The eye is divided into two parts: extraocular, the structure outside the eye like fat and muscles; intraocular, the eye globe and intraocular structure. Moving on to the video, initially you are seeing the yellow color periorbital fat. After removing the fat, you see the extraocular muscles like rectus and obliques, which are responsible for the movement of the eye. Removal of extraocular muscles reveals the eye globe that is covered with the sclera. The sclera is a protective layer which extends from the cornea in the front to the optic nerve in the back, which encloses the whole globe. On removal of the conjunctiva, you are able to see the transparent cornea anteriorly. If the sclera and cornea are removed, just posterior to the cornea is the transparent aqueous humor, as seen here. The choroid, which is a highly vascular layer deeper to the sclera, is also seen. The part of the choroid visible in this view includes choroidal connective tissue and uveal tract where ciliary body arises. Also, now you can see the deeper layer of retina with its anterior end called as ora serrata, which merges with the ciliary body. The vitreous humor can also be marked out in this view. Now you can see the structural details of anterior part of the vitreous humor of the eye. Here you can see the petit canal, also known as the capsulohaloid space, anterior vitreous cortex, and anterior haloids. Removal of the aqueous humor reveals the iris, lens, and ciliary body. Iris is a thin, muscular, pigmented annular structure in the eye responsible for controlling the diameter and size of the pupil. After removal of the choroid, you see the deeper retina, the optical lens with suspensory ligament, and vitreous humor appearing like jelly. Upon lens removal, the vitreous is more clearly appreciated. Now, I have bisected and removed the upper half of the vitreous humor so that you can see the details of the retina. Here, you can see a canal in vitreous humor, also known as Cloquet's canal. On complete removal of the vitreous humor, you see the inner surface of the retina with its vascular structure. As you see now, the fovea with the surrounding macula in the left aspect of this video and optic disc or blind spot on the right, which is a region in which no sensory visual receptors are present and is the site of exit for the axons of the sensory visual receptors. Retina. The retina is a layer of tissue in the back of our eye that senses light and sends images to your brain. Resting inside the macular retina, the fovea, also called fovea centralis, provides our absolute sharpest vision because there is a high concentration of photoreceptor cells present on the retina. Only in the fovea are the layers of the retina spread aside to let light fall directly on the cones, the cells that give the sharpest image. A small portion of the retina of each eye corresponds to exit of axons of photoreceptors, which carries sensory impulse to the brain. This is the optic disc, also known as the optic nerve head, within the retina. This zone does not have any photoreceptors and that's why called the blind spot of the retina. You can also see the vessels are emerging and spreading on retina from the blind spot. Now that you have seen basic anatomy of the normal eye, let me tell you about the etiological process of macular degeneration in short. Factors like smoking, age over 50, high blood pressure, obesity, and nutrient deficiency are some of the common causes leading to the modification of Bruch's membrane, retinal epithelium, choroid complex, and photoreceptor cells. Age-related macular degeneration has 3 stages of progression: early, intermediate, and finally the late stage, which is further of 2 types: the dry or geographic or atrophic or non-exudative type, and the wet or neovascular type. In the early stage, you can see drusen pigments on retina around fovea. Drusen pigments are accumulation of subretinal protein and lipids. It accumulates between Bruch's membrane and choroid. In early stage, as you can appreciate, the drusens are of small size to medium size. There is sparing of fovea and so is the vision. Now, let's talk about the intermediate stage. In the intermediate stage, you can see the drusen pigments become larger in size. There is some involvement of fovea, but the vision is still preserved. After the intermediate stage, let's go to the late stage of the age-related macular degeneration. As you can see, there are two types of macular degeneration in the late stage. First one is the dry geographic atrophic non-exudative stage. At this stage, the atrophy of retinal cells is present. This stage is irreversible and vision loss is progressive, slow. Another stage is wet neovascular, which is seen only in 10% of cases of age-related macular degeneration. This stage has a rapid vision loss, which is irreversible and thus has a poorer prognosis. Please note that early, intermediate and dry geographic stages forms 80 to 90% of cases of macular degeneration. Now let's get back to the late dry geographic atrophy non-exudative stage in detail. As you can see, the size of drusen pigments became larger in size and atrophy of retinal pigment cells are seen. Please note that here that the larger drusen size is involving most of the macula and fovea. This explains the progressive slow vision loss seen in this stage. The vision loss is irreversible and progressive. The vision is affected slowly over a long period of time. This disease is mainly in patients over the age of 50. Now, let's talk about wet neovascular stage. It is only seen in 20 to 10% of cases of AMD. As you can see, the drusens are large sized along with neovascular growth in retina. The neovascular growth is due to the VEGF, vascular endothelial growth factor, which forms vessels behind the macula. These vessels leak fluids and blood in the retina and it leads to scarring of macula. As you can clearly see, there are exudation in the fovea. Due to neovascularization, this stage has rapid loss of vision as compared to dry stage. This neovascularization results in complications like detachment of retina and also the tear of retina.